Yeah, his name is that.
This is a presentation on Lupus by Caroline, Bridget, Tessa, Mike, Jawad, Abdullah, and Farhad.
Lupus is a Latin word for wolf, and this is because patients with lupus had a symptom of a skin rash that looked like wolf bites. It was first coined by a Parisian in the 1850s, and it's an autoimmune disorder that is commonly found in the African American origin. It's a chronic illness, meaning it's prolonged. Once you have lupus, it's a lifetime disease. Lupus is an autoimmune disorder where the immune system malfunctions and causes the production of mass antibodies that are directed to attack the healthy cells. This leads to symptoms such as swelling, scars, joint pains, and hair loss with mouth sores. There are 4 common types of lupus. There is the systemic lupus, which is the most common type of lupus. There's also the drug-induced lupus, neonatal-pediatric lupus, and the subcutaneous lupus. 90% of the patients with lupus are females. However, men also get diagnosed with the disorder, and it's known to affect the skin, the joints, and in severe cases it affects the heart and the kidney.
Lupus occurrence have been decreasing since early 1990s from 27.7% to 4.91% in the late 20s. This is due to improvement in the medical field. Women are also 6 times most likely to be getting lupus. Also, the Black, the Chinese, and the Southeast Asian communities are more likely to develop lupus. Lupus believed to have 3 main factors. First of all is genetic factor, which include MCA gene, the SLA class 3 microRNA, and the deficiency of complement system C2 and C4. Also, they have hormonal factor, which include the hormonal therapy for patients which have drug-induced lupus, while oral contraceptive does not lead to any significant result in lupus. Also, for the hormonal factor, you have menopause, puberties, and pregnancy all lead to some cases lupus developing in women. Also, they have environmental factors such as UV radiation, but this is insignificant. It plays as a complementary role to the genetic factor.
Hey guys, I'm Tessa, and I'll be talking about the signs and symptoms of lupus. So there's so many symptoms a person can face, and it doesn't necessarily have to be the same one as the other person beside you. But there's 3 main common ones. The first one is joint, muscle, and aches and pains. And the second one, which is shown by our picture, is a permanent rash that's over the cheeks, going towards the face and nose. And then the third symptom is extreme fatigue and weakness. However, we can also experience other symptoms, such as increased sensitivity to UV light, and in women, most of them, they have a high chance of miscarriage, and they can also have flu-like symptoms or night sweats, and in other cases, some people can gain or lose weight. Thank you.
Prevention of lupus. There is no specific prevention for lupus. However, if the signs and symptoms are known and the disease is detected early, of course the early detection means it will be easier to treat. Scientists believe that leading a healthy lifestyle does obviously play a major role in preventing not just lupus but a lot of disease.
Laboratory test for lupus. Complement level test. It's a chemical found in the blood that forms part of your immune system, and the level of the complement decreases when the SLE is more active. The second one is erythrocyte sedimentation rate. This is a test which will determine the rate at which the red blood cells can settle at the bottom of a tube in a space of a given time, a faster than normal rate may indicate an inflammation such as that was caused by lupus. Urinalysis. This is where a patient's urine sample is examined so as to establish if there is an increased protein level or to identify the presence of red blood cells in the urine. 4. Anti-nuclear antibody test. The positive presence of antibodies that are produced by the immune system will then indicate a stimulated immune system, and a positive test does not alone diagnose lupus disease. Therefore, in this case, a positive test, the doctor is most likely to advise for further testing. Imaging testing. In the case of where the doctor suspects that lupus is affecting your lungs, heart, liver, and spleen, she's most likely to suggest x-rays. 6. Biopsy. Lupus disease is known to cause a renal damage. Treatments may vary depending on the type of damage which has occurred.
So prognosis of lupus, 70% of lupus patients suffer from systemic lupus erythematosus. It's the most popular one. Survival rate, however, has increased in the last 50 years or so. It was at 40% survival rate after 5 years of diagnosis in the 1950s and has gone up to 90% in the 1980s. There is a 5-fold higher chance of higher mortality rate than the general population. SLE patients between 35 and 44 also have a greater risk of myocardial infarction. They also have a significant morbidity, and contributing factors include active disease, SLE complications, and also treatments, the cytotoxicity of the treatments. SCLE, subacute cutaneous lupus erythematosus, has a better prognosis than SLE. There's spontaneous remissions, which are seen, and it's a less severe disease. Drug-induced lupus is always suspected in patients with no SLE history. However, it's a lot milder, and most cases become mild or disappear after the offending drug is discontinued. NLE, which is neonatal lupus erythematosus, manifests either cardiac or cutaneous findings. 65% of the findings are cardiac. However, the cutaneous findings are less severe and the less substantial mortality and morbidity. Mortality and morbidity of pediatric lupus erythematosus vary. It's a lot more severe clinical manifestations and up to a 3-fold increase in mortality compared to adult SLE patients.
Hi, treatment. Anti-inflammatory drugs are the most common drugs that are used for treatment of lupus. Anti-inflammatory drugs helps to reduce inflammation and pain. One of the anti-inflammatory drugs is corticosteroids, and there are synthetic prescription drugs designed to function in similar way to the body's natural occurring hormones, ACTH, which is produced by adrenal gland. Aspirin is also used to reduce the pain along with some other anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen, and these other ones, they're used like in particularly in joint pain and stiffness. People suffering with lupus, and the other drug that is used is an anticoagulant, and it's used to prevent the blood from clotting. Respiratory corticotropin injection, it contains ACTH, which is a hormone that supports the immune system to fight against inflammation and stuff like that. Benlysa, which is also called Lymphostat B, is the first and only drug that is developed specifically for the treatment of SLE, and it's approved by the Food and Drug Administration of USA and the European Evaluation Agency.